So some housekeeping rules. Once you've dialed in, you can press *7 to talk or *6 to mute your line. You can also use the chat box on your window there on your computer to communicate with us. So if you ever have a question, you can press *7 to talk or *6 to mute your line. Right now, all the lines are muted just so that we can eliminate some of the background noise. But throughout the course of the webinar, there'll be an opportunity for you to at any time unmute your line or mute your line to ask questions and engage in conversation. So now that we've kind of talked about ourselves in some detail, we want to go ahead and ask you guys to talk about yourselves a bit. Right now we have about 13 people on the call. So if you can, give us your name, your affiliation, your agency or organization, your city, and also what your plans for NLAAD are. So any of your NLAAD plans. And I know I just noticed there's a typo here. We're not NLAAD. We're NLAAD, the National Teen AIDS Awareness Day. So sorry about that. That's my bad. We do know how to spell NLAAD. So I'm going to go ahead and unmute the lines. And again, just give us your name, your agency, organization, your city, and what your plans for NLAAD this year are. Okay. So it's going to get a little hectic, but we welcome this opportunity to kind of get to know each other a little better. So we're going to go ahead and unmute all the lines.
The conference has been unmuted.
So don't.
Hello.
Yeah.
Hello.
Hi.
Hi, this is AJ Johnson and Pat Ross from Baton Rouge AIDS Society in Baton Rouge, Louisiana.
Welcome. And what are your plans for NLAAD this year?
This is our 6th year having our testing event. We have 6 community partners. We're testing at 4 different sites, and we're testing in 1 neighborhood. So we have 5 testing events that's going to take place over the course of 2 weeks. We usually test around 60 to 80 people. And as unfortunately with the lack of funding in our community, the community partners want more testing events throughout the year. And as you may know, Baton Rouge is #1 in the country with the highest rate of AIDS cases. So we're continuously trying to find additional funding to do that.
Awesome. Awesome. Great. Well, thank you for sharing your story. And
Okay.
great to have on you. Great to have you on the call. Who else do we have with us?
Mark Gray here, Low Country AIDS Services, Charleston, South Carolina. We will have our 4th annual NLAAD event in the city of North Charleston, and we have a collaboration with the city government of North Charleston, and there will be a host of different CBOs and NGOs that will be working with us. This will be medical and social services available for the community, and we will be testing as well.
Wonderful. Thank you, Mark.
Hello, everybody. My name is Jean Hernandez. I'm from Ace, Alabama. This will be my first NLAAD event, so I'm very excited. We're going to do it in a school where a lot of Hispanic children attend in that community. So we're trying to engage our community, the children, the family, and the school. So everybody's on board, and also the health department is going to help us.
Great, Jean. Thank you. Don't be shy. Anyone else? I see some names on.
Hello?
Yes?
Yes, this is Peggy Owen. I'm the Executive Director for Substance Abuse Program for Back to the Basics, please, in Yuma, Arizona. I'm not sure what we're going to do at this point. Probably collaborate with what's called Border Health. It's located in Somerton, Arizona, near the border. Do some testing and probably some outreach presentation, and have at least some information available.
Awesome. Thanks, Peggy.
You bet.
Anyone else want to share?
Josh Ferrer from Cascade Project in Portland, Oregon. And the event we're doing, we had an event called Confianza Event. It's our 3rd year doing this event. And so we provide rapid HIV testing. And it's also just kind of through a cultural fair. We'll have different entertainers, singers from the local Latino community, a display of art by local Latino artists have food, some different games. So it's kind of a family-oriented event.
Awesome. Sounds great. Thanks, Josh.
Hey, Tony, this is Rebecca Dakota with the AIDS Institute. I'm an intern here, and what we're doing so far, we're trying to get things together. We're going to be working with the Metro Wellness Center, which is in Ybor City here in Tampa, and also with the University of South Florida Health. And our hope on doing the University of South Florida Health is to set up tables and give out information and some testing. We won't personally be doing testing, but USF for the college age students for the Latino population.
Awesome. Thank you, Rebecca.
Hi, Ginger Washburn from Peers for Positive Change in Santa Rosa, California.
Hey, Ginger.
Hi. We'll be doing some testing and outreach, and we have lots of condoms to distribute. Having a rally at the local Santa Rosa Junior College.
Great. Thanks for sharing, Ginger.
Thank you.
So we're very excited to hear. I mean, we try to be as direct with talking with you guys as partners on this call. There's several other people that are on the call that were feeling a little shy, I guess. That's fine. But we love hearing your stories about your events every year. What my hopes are as the new program manager for NLAAD is to garner more of a personal relationship with the agencies, to feel more connected with the agencies rather than a large group of agencies doing events across the country. I really want to start engaging in conversations with you like this one about your events and hear more about your stories and your events throughout the country. One thing I want to encourage you guys to do, just because I want to start highlighting some of your events that you do every year, especially for the agencies that have been doing it for several years now, is to start sending some of your images and pictures from your events. I would love to kind of showcase some of your events throughout the country and give you some publicity on our end for all the work and effort you've been putting into these events years and years after. So we want to go ahead and I'm going to go ahead and mute the lines again just so that we can eliminate some of the background noise. And again, if you have any questions throughout the webinar, you can go ahead and unmute your line by pressing *7 on your phone, and or mute it by pressing *6. But I'm going to go ahead and mute all the lines on my end right now, okay?
The conference has been muted.
So a little bit about us very quickly for those of the agencies that it's your first year, first couple of years with NLAAD. The Latino Commission on AIDS has several divisions. One of the divisions, and the division in which NLAAD is a part of, is the Comunidades Saludables Ahora, or it's translated to mean Healthy Communities Now in English. And it's a capacity building program designed to increase the access to and utilization of HIV prevention services amongst Latino nationally through the implementation and dissemination of community mobilization models. And we have 4 of these models, one of which is NLAAD. One of these models, another model aside from NLAAD, is the Mobilizing Emerging Latino Populations. So this is where we work with different communities and kind of helping them kind of mobilize themselves better. And I mean, we have Eric here and Anita, which are the prime examples of the people that are leading this cause here. So do you guys want to give a little more detail as far as what's going on with that model?
Yeah, well, community mobilization is really when we're building coalitions with a particular focus. On this particular call, we're focused around NLAAD. We're putting our support around NLAAD, and we're garnering the support from the different communities around to be able for this particular campaign. So the mobilizing emerging Latino populations is seen on the ground as the Latinos in the Deep South program. And throughout the South, and it's a little bit of a misnomer in a way, because this same model is really being applied in areas around the country where we're seeing emerging Latino populations. So your cooperation on this, your cooperation with NLAAD and your support towards this is really the force in which helps us guide and mobilize our communities.
Great. So thank you, Eric. The second model is the LRLP, or the Latino Religious Leadership Project, which focuses on partnering with faith-based organizations and increasing their capacity on addressing HIV/AIDS disparity issues. So we, rather than seeing Latino religious leadership, religious faith-based organizations, we really want to partner them because we partner with them considering that they are such a strong component of many of our Latino brothers and sisters. So that's kind of the focus on that one, is working with faith-based organizations and improving their capacity on how to address these HIV/AIDS issues amongst members of their congregations or what have you. And National Latino AIDS Awareness Day, which we'll go into more detail now and what we're here on the call for. We'll save some time for that since it's the main focus of the webinar in a minute. And then we have the Hispanic Healthcare Worker Mobilization. And this works similar with areas where there's an emerging Latino population. Sometimes some healthcare agencies don't have the capacity or know-how or the cultural competency to work with the populations that are emerging, specifically Latinos. So we work with them in kind of building their capacity to better mobilize and work with the emerging populations that they see within their communities. So those are the four models that are housed under this division of how the communities now, or Comunidad Saludable Solar. So that's kind of just to give you a perspective as far as where NLAAD falls within the greater scheme of the Latino Commission on AIDS. The objectives of today's webinar are to learn the guiding principles of National Latino AIDS Awareness Day. So what exactly is National Latino AIDS Awareness Day? So how to conduct street intercepts, and along with that, what are street intercepts, right? So how are they going to benefit you as an organization, as an agency, or as a coalition, right? And the benefit of using street intercept data to enhance HIV prevention and education efforts in your region. So what do you do with this information once you've collected it and we analyze it for you, right? So these are all things that by doing, you're going to end up improving your programs because you're collecting information that we are analyzing for you and producing a report for you to use in any way you see fit. So it's especially beneficial for agencies that don't have a research and evaluation department to have something like this produced for them. So to kind of go over NLAAD in a little more detail, yes, it's been considered a social marketing campaign that's implemented every October 15th, which is the last day of National Hispanic Heritage Month. But I like to think of it more of a community mobilization campaign, which is why it's housed under the Comunidades Saludables Ahora. It's because I really do think that from our efforts across the country during these events, it helps with the mobilizing and educating of our community, Latino community, right? So in this, we try to reduce high-risk behaviors and adoption of healthier behaviors, right? So depending on what your events do, it could do as many as, maybe your events are focused around testing, but it could also be around how are you disseminating information amongst your community members to reduce risk and increase healthier behaviors. And it increases knowledge of target populations, specifically Latinos, about the impact of HIV and AIDS, increase the knowledge of methods by which transmission of HIV/AIDS can be prevented, increase counseling and testing services for higher risk Latino Hispanic populations. And these are just examples of many things that a lot of our NLAAD events focus on. And I'm sure there's many more you might be willing to offer. And briefly going over the history of NLAAD, it was started in 2003 through a collaboration of the Hispanic Federation and the Latino Commission on AIDS. I'm sorry. It was created to cast the spotlight of the AIDS epidemic on the faces behind the statistics. So we as Latinos are highly impacted by the HIV/AIDS epidemic, but it wasn't very much seen or it wasn't given a face until we decided to do this through some sort of collaborative effort with agencies across the country to make this known, right? And like I mentioned a minute ago, it takes place on October 15th, which is the last day of Hispanic Heritage Month in the United States and territories.
Okay, great. Thank you, Tony. And just wanted to add a little bit more on the background of NLAAD, and particularly every year the program manager, the program directors invest a lot of energy to create a national steering committee, a community organizing committee to support NLAD to find the more important issues to address at the local level. Although we create the campaign kit, we create the posters, at the end of the day, each community owns their own MLAT event. And by having a national organizing committee, the commission allows your organization and your members and your partners in your area to identify the more effective messages. And the tools that we create for the toolkit are just an additional resource for your efforts. So we invest a lot of time on conducting community assessments, and we will talk about that in a few minutes when we start discussing what is a street intercept and how important it is for your organization and your local efforts to utilize the local data. NLAAD invests a lot of time in event planning. You have attended calls in the past to know what events are you developing, what is the population that you are targeting, is there a new partner in your area that you are inviting to be part of the effort? And the resource development also is another component of the core activities of the NLAAD campaign. That means that we make sure that you have all the resources available from press release samples, from how to organize a fundraising to help you fundraise money for your upcoming event, how to frame messages for faith-based communities if you think those are key to partner for your upcoming event, or if this is an ongoing effort that you have with faith-based. We also provide you with the tool of messaging how to work in collaboration, because the key word in this effort for NLAD is the collaboration. Community mobilization entails that both partners in the table has ownership, and you both has decision making in the process of organizing your event. By coming together, community mobilization allows not to replicate efforts, that we can combine resources, we can combine key allies to come together. And we're going to have in a few minutes our friend Mark Gray from South Carolina sharing a little bit of that experience and how important it is to combine those local resources. Social marketing is another core activity. We also have samples of, first of all, we provide trainings via webinar on the basics on social marketing to make a difference between social media, Facebook, and all that, and make a difference what social marketing is and how important social marketing, um, how social marketing can make a difference for your purposes of disseminating prevention messages, education messages, or as well to um, start your own advocacy efforts to mobilize local elected officials in your area and to bring the Latino issues into the local agenda to create change. Networking, community mobilizations, another, in addition to collaborations, networking is key. We cannot impact or create change by our own means. We need to collaborate with different partners and media. As you can see in one of the pictures here, we have North Carolina event, don't remember the year, but the purpose of this local organization, in addition to have a local event, it was to make sure the media not just cover the NLAD event, but also puts the messaging, the importance of having local resources for Latinos um, living with HIV and AIDS, or to provide a response for prevention purposes. There are different ways in which local partners see how to frame and how to put together an event. It can be a testing event, and I heard several of you having within the agenda testing events. It's great to hear that some of you, this is your sixth year of being part of NLAAD, that you have six different community centers, community partners. So that means your power is growing at the local level, mobilizing the community, mobilizing perhaps new allies. And it's great to hear as well that you're using art. And as you can see there in the Memphis event, that the picture that we have, It's how important it is to bring the Latino culture when you are planning not just to attract the populations that you're intended to target, but also how important it is for Latinos to see that elements of our culture that speak about not just the need of prevention and education, but also reinforces the Latino culture pride. And the website right now, our website is still experiencing some problems. Every year, the NLAAD website offers great resources from fact sheets, the toolkit campaign. We have some PSA that, if possible, that if you have a partnership with local media, you can utilize in your community. There are different resources. We hope that our NLAAD website will be up and running with all the amazing resources will be up and running soon. And testing events. As you can see, the Chicago picture and the other event at the faith-based community, those were intended to provide free HIV testing. And how important is to have those events, not necessarily in health settings, but in a non-HIV related settings that for some communities, they feel welcome as well to attend HIV prevention events in non-HIV settings, health settings.
So as we've learned, in that the Latino Commission on AIDS has been growing and nurturing NLAAD for close to a decade now. And the way that we've done this is really trying to mobilize communities and be able to give good information and collect good information from those who are on the ground within their own communities. The evaluation and research has been a great way to be able to help grow this. And so on a national level, we partner with all of you to be able to help continue to grow this campaign and to continue to bring awareness of the Latino plight within the HIV epidemic. So we really appreciate your support in being here today. Now, I want you to understand that when we're talking about evaluation, we're looking at it from two points of view. We're looking at it from the point of view of how it's going to help your event on the ground. You are experts in your own communities. The types of events that we heard at the beginning of the call, some involved testing, some involved cultural events. They involved bringing together health departments with community-based organizations. They involved collaborating with each other. We want to be able to help you collect the data on the ground so that in future years we can continue to grow this as a national campaign, as well as you can grow this within your own community. So what we're asking you to do with us now is not just to be able to partner with us this time, but we want to be able to continue to nurture this relationship over time. So the benefits of being able to do this type of evaluation, I mean, evaluation comes in many different forms. I mean, we can collect evaluation by finding out how often our events are cited in the media. Or we could do surveys at our particular events to find out more about our population. Or we can do street intercepts, which is what we're trying to do today. What we're interested in doing is working with you guys to be able to collect on-the-ground information about awareness of the National Latino AIDS Awareness Day. We want to understand how many people have been aware of NLAAD before October 15th. And then we want to find out again how many people are aware of NLAAD after October 15th. So what we're asking is not to actually do brief street interviews on October 15th, but just before and just after, because we want to understand what kind of effect this is having. This is an example of the type of survey that had been done in the past. And although the survey continues to change because we learn every year what type of information that we have, what type of information we need, and what type of information helps better serve our communities as well as helps serve the national campaign overall. So this is just an example of the type of questions that we're asking folks to ask people on the ground within their communities and to better understand more about their awareness of National Latino AIDS Awareness Day.
Right. So, and adding to what Eric is saying now, I think the beautiful thing about conducting these surveys as an agency on your end is the fact that you're getting information about how effective your events and campaigns are, right? So all that work you're putting into creating this event annually, or some days before, or some days after, how beneficial is that? Is that really creating an impact in the community we're trying to serve? So a lot of this information that we're gathering is beneficial to you because you can see um, whether your efforts are beneficial or how beneficial they are. And you can see a lot of this information that we gather can also be beneficial to you in other areas as well. It's not solely about NLAAD on our end, but it's more about what you're doing, right?
So we're very proud to have partnered with Low Country Aid Services in North Charleston, South Carolina, for the past several years doing these types of street intercepts. And this is an example of some of the data that was collected in Charleston last year as part of the brief street intercepts. And as you can see, what we learned here is how people become aware of NLAAD. Understanding this helps us better utilize the resources that we have. Rather than if we understand that most people become aware of NLAAD in particular ways, it helps us understand where we should focus our marketing efforts to be able to get people out to our events, to be able to test more people, or to be able to create a bigger buzz around NLAAD for our particular agencies. This type of information also very well helps serve how we can reach this community even better. One of the main benefits is as to how this would help you is that we here at the Commission have the resources to be able to do the analysis for you. So we're asking you to do the intercepts. We would create a report for you, which is able to highlight the specific points in the survey that come from your community that can help serve in future years as to how you should allocate resources or how to better use your resources. So in this case, we see that in Charleston, most people heard about NLAAD by participating in events or from word of mouth. Not as many people found out about it through mass media, like television or radio. Now, you know your communities, and you know whether if people are not hearing about it as much through TV or radio, this might help you know whether you should be focusing your efforts on trying to partner more with television stations or with news stations to try to create more of a buzz that way, or to be able to partner with radio stations. Or even partnering with other organizations. So we would like to continue, we're continuing this partnership with you, but as NLAAD goes on in future years, we want to be able to help you use this data so that we can help you focus on growing your campaign on the ground. So though we're asking you to take some effort in doing this, we also want to be able to use this information to help you in future years. This is also another example as to some of the efforts that were done. And so in this case, in 2011, Charleston we're talking about testing. So from those who had never tested, more of them knew about were not aware of NLAAD, as opposed to those who were aware of NLAAD had tested at some point. So it's very hard at this point to extrapolate whether one had an effect on the other, but this can also help us grow our testing campaigns as they work in tandem together.
Right. So as you can see, we provide very customized information and analysis on the surveys that you collect in your community that can be very beneficial to the communities that you're serving. So this is very customized and very recent for the agency that we work with Mark Gray, that we have on the call now, and using this information for their future NLAAD events.
So on the line with us right now, we have Mark Gray, who's from Charleston, South Carolina, and who's been a great partner with us. And if Mark, I'd like for you to share your experiences with us. If you could give us just a little bit of a taste as to what it has been and what kind of effort it has taken to conduct these brief street interviews and what type of benefits you might have seen from it.
And you can go ahead and talk by pressing *7, Mark.
Okay. Good afternoon, everyone. It's great to hear of all these events that you all are planning for your NLAAD events. For us, here in Charleston, it was more of collaborating with other organizations, collaborating most definitely with our Hispanic advocates, the gatekeepers, and coordinating an effort for this event and showing that by bringing other organizations, not only just standalone HIV, but medical, social, financial, and legal services that are doing pro bono or for nonprofits. If we come in as a health village for these events, we find that we gain more people's attention, we have better attendance with the NLAAD events because there's something there for everyone. The food banks are there. We have a DJ that brings in music. The schools bring in dance organizations to bring in cultural dances that are appropriate for the community. So in doing that with the street Intercept, particularly prior to, I will say a lot of people are not aware of NLAAD, but as we get closer and closer and our colleagues within, particularly the newspapers, we have two newspapers here, they will start to pick up and run interviews, particularly with the agencies that are involved. And it's interesting on the one graph, most definitely, I will say for us here, it is word of mouth. And it's distributed throughout, the information is distributed throughout all of the different collaborating partners and their organizations who are dealing with different levels of the community. So it is most definitely a collaborative effort by many organizations, and we're very lucky here in Charleston to have a city government that is very pro-Hispanic and is willing to work with the community, with the collaborative partners, and with the advocates.
Awesome. Thank you for sharing, Mark. We really appreciate your efforts here.
Okay, so what is our role in this process? Well, first of all, this is an introductory webinar to describe the purpose of the street intercept and also how you can use that data at the local level. Let's remember that sometimes data on Latino issues, health issues, are not that quite available. So by having this partnership with you all, we are in collaboration, investing time and energy in producing local data that can, just like Eric mentioned, tell you the issues that can be of interest for you to address during your MNET event. It can be, I am aware that in some areas, people is not willing to take the HIV test. Perhaps you want to find out what are the reasons behind that. Like, is it stigma? Is lack of access to local services? Is a language barrier? Is immigration issues? What are the roots of preventing folks from taking the HIV test? Or perhaps it could be why women get to test on HIV more than men. So what is the reason behind that? So we can provide you with a series of webinars to help you understand not just the rationale behind the questions for the questionnaire, so you can be able to better equip to explain the purpose of each of the questions to your participants. Sometimes I have done street intercepts in the past, and sometimes people ask you to reword the question, to explain better that question. And that's why it's very important for us to provide you with the necessary information and to provide you with as many coaching opportunities for you to understand the purpose of the instrument and why this needs to be implemented before October the 15th, just like Mark mentioned, that many people didn't hear about NLAAD months before, but as the event gets closer and as his local coalition is investing more energy and activities to promote the event, more people is aware of that. And another resource that we can provide as well is the street intercept, the pre and the post. Uh, we will be sending you a packet with 100 surveys for the pre and post. And we ask you to please have a minimum of 50 surveys completed to have a meaningful data to analyze and to provide a meaningful data um, regarding your local community. And we also support you with the postage. We provide you with an envelope and an account that you can use. We use FedEx or UPS to make the process, to speed up the process, to send the materials and for you to send us back the service. So those are some of the resources that we have available. And in addition, we have the staff at the commission here for you to support you within the process of implementing the streets intercept. Also, if you need support of how to better recruit your potential volunteers to help you conduct the streets intercepts, we can also create a coaching on that. Um, and the idea that at the end of the day is not only you investing the energy. Perhaps you have all you have all the energy, you're willing to do this, but you will need more hands to support you. So we can have some coaching sessions on how to help you take advantage of the local resources so that you can um, be part of the street intercept activity.
And to add to that, we, along with sending you the surveys printed beforehand with a return envelope, we also provide you with incentives, right? So we have incentives that we have annually, but these incentives are definitely guaranteed to all the partners that we have that are willing to participate in street intercept surveys. So along with the surveys, we'll be sending you um, a group of incentives that vary from bracelets to Android, to a series of different things that we'll send you along with those surveys for you to use during the implementation and conduction of surveys.
So what do we ask from you? In your role, we would ask for you to administer the surveys that we send you before and after October 15th. You would administer the survey wherever it is that you encounter the community. Also, we ask you to identify members of the community and staff and collaborate with other organizations if you choose to be able to help create more surveys. The more people we have fill out these surveys, the better the data is. So so we ask you to do this so the more and the better the data is, the better it is able to serve you locally within your community as it is to serve all of us as a coalition here. And then we ask you to mail the surveys back in the self-addressed stamped envelope that we send you. It's as easy as that. That afterwards we get to work over here on analyzing the surveys and putting a report together for you.
So even though we mail you 100 surveys for you to conduct before and 100 surveys for you to conduct after NLAAD on October 15th, we request that you submit at least 50 pre and 50 post. And again, like we just mentioned, that's just to make sure that the more surveys that we have, the more beneficial the data that we collect, and more true the data speaks to the needs of the community that we're trying to help. So that's pretty much what our role is and what your role is in the process of conducting the surveys and providing the report to you.
Right, now let's go briefly about how to administer the NLAAD street intercepts. And as we've been mentioning, you have to make sure if you are supporting the pre-NLAAD street intercept has to happen 2 weeks before of October 15th, and the post is should happen 2 weeks after the October 15 for NLAAD campaign. And we ask to please do not administer the street intercept the day of your NLAAD event, because the purpose is to learn the knowledge of the community regarding NLAAD, if they've been exposed to the messaging, to not just the posters, but also how you are advertising the event, the type of event that you are holding. If they can remember past events, what is the message they remember? If they were due to being exposed to the NLAAD event, the promotion of NLAAD, they they decided to take the HIV test. So it doesn't make sense if you conduct the street intercepts the day of your NLAAD event on October 15th because of those reasons. And make sure that you and your partners, your local partners, even agree on which neighborhood or zip code you would like to cover and why. What is the reason that you're choosing that area? Is it that it's a Latino, new immigrant area? It's a low income neighborhood that you're interested in learning a little bit more of the knowledge on the campaign? Is a new neighborhood that you are trying to reach out, or is a neighborhood that you reached in the past? Just make sure that you have ID with you at all times. Sometimes people feel comfortable of having strangers in the area. It's just for your safety. Make sure that you go in pairs. Also agree on the time and the days. If you think that you're not going to be able to administer all street intercepts in one day, agree with your partners how many days or the hours of the day that you think will be beneficial to administer the survey. Let's remember that rural areas and metro areas are different. Some of you have conducted in metro area nearby bus stations. That's great. But think about what are the conditions in the rural settings. What will be the best setting for you to conduct the street intercepts? And for that, we are also here with you to brainstorm potential venues for you to conduct the street intercepts in a rural area, in a rural setting. And when you ask people to support you answering the questions for the street intercept, mention the purpose of why the purpose of the instrument, why it's important for NLAAD and for your organization to collect this data, and how important is going to be that support, how important are those responses. And it doesn't take that long. It's a very short questionnaire. If they haven't heard about NLAAD, it's going to be even faster. It's going to be less than 5 minutes. But if they have heard about NLAAD in the past, and if they have attended an event, it will take a little bit more, no more than 10 minutes. Be mindful about the participants' time, and also if you're conducting this on a very busy area, be mindful of the participants. If they are there waiting for a bus, if they are there picking up their children, if they are doing something that perhaps you're gonna stop them for doing. Be mindful of how much time you're investing, and make sure that you go over all the questions, even if they don't know the answer. If they haven't heard, make sure that you go over the questions as well. And it's okay for them not to know about the campaign. That's the purpose. We would like to know, and you would like to know, how many of your local fellow community members know about NLAAD, and how many don't know. How many know and how many don't know about the campaign. And last but not least, incentives are part of the effort. Once they are done with the survey, make sure that you hand over one of the incentives that you have available. And again, always safety is very important, and to plan ahead of time, the best day. In case of emergency, also have a plan. It's for your safety as well.
So that was a very quick recap of how you go ahead and administer the NLAAD street intercept surveys. Along with the surveys, when we spit them out, we send you a quick summary sheet summarizing all the information we just covered. So if there's ever any question along with that sheet that we sent to you, we're also available here at your disposal with any questions you might have. There were two questions that were asked by our partner here, Steven Vargas. One of the questions was whether the data will be interpreted to develop a national picture and a local picture, and that's very much the case. So we do produce a local report that's customized to your community and your agency for your agency to use, but we also merge all the data together and produce a general report that captures all the information from all the surveys that were administered throughout the country. So you can start seeing how your efforts in your community fit into the local and national need of the data that's being collected. Another question with that was, what if our NLAAD event is to be held on October 13th, 2 days before NLAAD, which is October 15th? Shall we administer the surveys on the 13th? And the thing is that we recommend that you do not administer them on the day of your event. And that's because, again, we don't want to skew the information, because if the people are actually at your event, it's going to be more likely that they already know about NLAAD because you're hosting an event about NLAAD. So we want to make sure that we want to find out how effective your event and campaigns are by collecting information before the actual date of the event and also comparing it to that of the event after. So there should be some difference between the beginning and the end. So thank you for those questions, Stephen. Very good questions.
So what happens when once you're finished administering the street intercept surveys? Well, you put them in the manila envelope that we had given you that is self-addressed, and you send them back to the commission's care of Tony Ochoa. And as soon as we get them back, we get hard to work at analyzing it and planning for next year's events. Also, we would like to we get cracking on working on your reports, so that we can engage you with the information that you've helped us collect. And ideally, we would like to continue that relationship to be able to help you with your event for the following year, so that we can work smarter year after year.
So again, the beautiful thing on collecting this data is that we can then provide you with free capacity building assistance that's customized around the findings from these surveys. So once we have the data to back it up and we can find areas in which we can focus our efforts and providing you free capacity building, it's another added bonus. And then you can start seeing your actual imprint on what's going on with NLAAD at a national level. So the data that you collect also then influences what we want to do with NLAAD moving forward, right? To make sure that it's effective for the communities that we're trying to reach and work with, right?
Yeah, we want to do this. We're working together, and working together. This is how NLAAD as a campaign, as a national campaign, as a local campaign, will continue to grow.
And an additional suggestion: sometimes people share items or ideas that are not in the survey, but you find that those are useful, or you would like to find out more data to document the rationale behind that comment. Feel free to take note of that comment in that survey, just for you to remember. And we would love to debrief with you all. As Eric mentioned, this instrument can be improved for upcoming campaigns to reflect the needs of your local community. So make sure that you take note of those interesting comments as well. It can be regarding stigma, it can be regarding to access to care, different things that you think are barriers for people getting tested, or barriers for people attending your NLAAD event. So that's another idea.
And someone asked if it would be appropriate that while you're conducting street intercepts prior to NLAAD, if you can go ahead and maybe pass out a flyer promoting your NLAAD event after you administer the survey, and that's completely fine, as long as it's done after you administer the survey, right? So you can ask them the questions and get the survey from them, and then provide them with the flyer to your event that will be taking place a couple of days or weeks prior or after to you conducting the survey.
Yeah, for the purpose of the evaluation, it's important that it be done after. But it's also a really great opportunity to make that contact with that person and help them know that you have an event coming up.
Right. So definitely. What I'd like to do now is go ahead and unmute all the lines So again, it might be a little crazy with the background noise, but I want to give you guys an opportunity to ask any questions that you might have on the actual phone line. You can also continue to still ask questions on the chat function, or even email me at the contact information here. But I want to unmute the lines to give everybody an opportunity to talk over the phone.
The conference has been unmuted.
So does anyone have any questions about the purpose of street intercept surveys and how you as an agency and community can benefit from conducting them, or anything along the lines of administering them? The lines are currently unmuted. So feel free to just talk. You don't need to press anything.
Hi, this is Ginger.
Hey, Ginger.
I'm wanting to know how soon we could get the surveys.
We just had someone ask the same question. We're in the midst of finalizing the survey this week, so we can ship it as soon as next week. So we can, once we get confirmation and commitment from you, we can send those out as soon as next week,
Okay.
along with the incentives and all that other information we talked about earlier. Thanks for that question, Ginger. That's a good one. Anyone else?
Yeah, you did mention some training for effective communication in regards to presenting information about AIDS and HIV awareness. When would that be available, and how do we go about doing that?
So when it comes to we, as part of our community mobilization efforts, we also provide information, health information, and training for our partners throughout the country. And this is as part of NLAAD, but it's also part of what we do here year round. So we'll be more than happy to talk to you about how we can help support not just your community, but help support your specific agency to be able to help build your capacity and better be able to serve your population.
Right. So what that's called is, it's called capacity building assistance, and that's provided to your agency free of charge. We're funded by the CDC to help AIDS service organizations in any way they want. So we provide a very customized training on whatever that need may be. So if it's about communication and developing materials, then we can help you about how to go about producing that for the communities you're trying to serve. And that's done by submitting a request. And if you like, you can go ahead and contact me or Eric on this information via the information that's on the slide, and we can walk you through the process of submitting a request for capacity building. And then again, that's free of charge.
All right, thank you.
No problem. And like I mentioned at the beginning of the webinar, this webinar was recorded, so we can go ahead and share that that YouTube video once I upload it to YouTube with your partners, in case anyone might be interested in conducting intercept surveys. So after this webinar, I'll go ahead and send you guys an email with that information, summarizing the webinar, and also seeing if anyone else is interested in partnering with conducting intercept surveys, what the next steps moving forward would be for that.
Oh, thanks for that, Tony. This is Stephen Barton from Houston. Thank you for letting us know about the YouTube. I'm going to see if I can use that to share it with the folks from the Latino HIV Task Force. We're hoping this is our NLAAD event this year.
Awesome, Stephen. Thank you so much.
Thank you. Yes, Tony.
Yes.
Hey, this is AJ Johnson, Beverage Aid Society. I was wondering, we already put our large different posters at each site. We did 4 different posters advertising the event ahead of time, and then we're looking at putting some other advertisements and marketing strategies before the event. Is this going to interfere with the survey?
No, not at all. Actually, part of what we collect in the survey is where they heard about the actual about your event from. So it could very well be that it could be from the posters that you put up, and it can let you know that, hey, people are really using these posters and getting information from them, and it's letting you know that they're effective and you're putting them in good places. So it's definitely okay if you're putting up posters. That's what you're supposed to do, and what we're expecting to capture from administering the survey.
What we hope that you wouldn't do is wear an NLAAD T-shirt while you're collecting it, because that in itself is the interviewer giving them making them aware of it just by being there. But just by handing them the survey and asking them to fill it out, once they filled it out, then you can give them as much information as you want. But if they found out about it because they saw it on your window, that's great information. That's great information to know.
Thank you, AJ.
Thank you.
So Tony, it's Ginger again. Sorry, I'm a newbie.
It's okay, Ginger.
How do we get the posters?
I can send you those posters myself. I just began a series of printing, so we have those posters right now. If you can't, send me an email letting me know how many posters you want, and I can get you started on that.
Thank you.
Hey Tony, this is AJ again.
Hey, AJ.
With the other materials, are they going to include T-shirts? I heard someone say about wearing T-shirts when you're doing a survey.
So if you do street intercept surveys, you're guaranteed all the materials that we're talking about. So I will be sending you some shirts. So the people that conduct, like I mentioned earlier, street intercept surveys are guaranteed to receive incentives and all the other materials. So you'll be getting like shirts, the posters, and some other incentives like the bracelets and the keychains, the condom keychains, and some random small incentives that we have for NLAAD.
Okay, thank you.
No problem. And that will all be sent together with the surveys.
This is Stephen in Houston again. I'm going to be participating in Gay Men's HIV/AIDS Awareness Day event on September 30th. With that, it's not really dealing with the NLAAD. Do you think that might be an appropriate venue to do some surveys?
Yeah, that would be. That would definitely be a good place.
Okay. Thanks. It's AJ one more time. Sorry.
No, it's okay.
Even in the past, they've had Orquick gave out push cards for every site with the site name printed on it and the testing day and the agency name as far as hosting the event. Are you guys coordinating that, or are they still doing that?
What we are coordinating with OraSure this year is if your agency is conducting testing, we just received confirmation from OraSure that they'll be partnering with us again this year to provide free testing kits. But I'm not aware of what that punch card might look like or what that is. But all that information can be answered on the poster that we send you. So I'm not sure if that's different from that or if it's something else.
It's a small pocket-sized push card. It folds in half, and it has the advertisement of the Orquick testing instrument, and it has the information on the testing event.
Does that come from OraSure? They're from OraSure Technologies.
How did you receive that? Did you receive that directly from them?
I think last year it must have been from John, the Orquick, the OraSure representative must have taken care of that. But it was for National Latino AIDS Awareness.
Okay. So the way that works is
they've done that for the last 2 or 3 years in a row. There's small palm cards and also the availability of a banner necessary. Right. To have all that information on there when your testing event is, where the location is, and so on. I haven't seen anything like that yet, but it sounds like that was something totally separate from the testing kit.
right. So I can ask them. I'm supposed to have a call with the person that we're partnering with to offer the free testing kits this year and see if that's available to send, because that comes directly from them. We don't ship it to you. We don't ship the testing kit to you. It's shipped from their offices to you. So we never actually see them on our end. But I can ask them to see if any other information like the pop card or posters are included.
Okay, because they gave like 200 printed ones for each site, so that was helpful.
Okay.
That's great to know.
Great. So if you have any questions, you could reach me at any time via email or phone. My email is shown on the slide here. It's tochoa@latinoaids.org, or you can contact me by phone, 212-675-3288 at extension 337. And I want to thank you guys again for calling and joining us on this webinar today on street intercept surveys and how they can improve your NLAAD events in the future. So we look forward to potentially partnering with many of you if we haven't already. And thank you again.
Thank you, guys.
Thank you.
Bye.